Welcome to The Explainer. Today, we're doing a high-impact clinical briefing just for pharmacists. We're going to zero in on your role in counseling patients on contact lens care because, as you'll see, a simple conversation can prevent some really serious harm.
Let's just start with a number that should honestly stop you in your tracks. Up to 99% of people who wear contact lenses don't follow their care instructions properly. This isn't just a small issue, it is the single biggest threat to their eye health. We're talking about pretty much everyone who wears them.
So when a patient is standing right there at your counter, buying their solution, you are literally on the front lines of this problem. This explainer is all about giving you the tools to bridge that massive gap, starting with the very next person you talk to. Here's our game plan. First, we'll look at the adherence crisis. Then, I'll give you some key questions to ask. We'll cover those critical drug interactions, break down the different lens care systems, and wrap up with the most important counseling points you can use right away.
So why do we care so much about that 99% number? Well, because it's the root cause of most of the complications we see, and these are preventable. We're talking about everything from some minor irritation all the way up to sight-threatening infections like microbial keratitis, which can cause permanent vision loss. So, what can you actually do about it? Well, your first line of intervention is simply asking the right questions. Think of this as your diagnostic toolkit you can use right there at the pharmacy counter to quickly spot a patient who might be in trouble.
Okay, so a patient comes up and complains about their lenses. This is your first and honestly your most important question. Are you having any redness, irritation, pain, or blurred vision? How they answer this is going to dictate everything you do next. Now look, these symptoms are major red flags. They could be caused by a whole host of things. But your role here isn't to diagnose what it is. Your job is to triage. The only correct and safe advice is always the same. Tell them to take their lenses out immediately and call their eye care professional.
All right, let's shift gears to an area that is your bread and butter as a pharmacist: drug-lens interactions. This is truly one of the highest value things you can do for these patients.
And I really want to pause on this because it's that important. Think about it. An eye doctor might not have a patient's full medication profile, but you do. This makes you the crucial safety check in the system. You're perfectly positioned to catch things no one else will.
So, what should you be on the lookout for?
Well, a lot of the usual suspects. Antihistamines and diuretics can dry out the eyes, making lenses feel terrible. Sedatives can actually make people blink less often, which messes with lens hydration. And then you have drugs like rifampin that can literally stain soft lenses a different color. Spotting these helps you manage their expectations.
And it's not just systemic meds. A lot of eye drops can cause issues too. The #1 offender is the preservative benzalkonium chloride, or BAK. It actually gets soaked up by soft lenses and can become toxic to the eye. So the key takeaway from most eye drops is simple. Tell patients to take their lenses out, put the drops in, and wait a solid 15 minutes before putting them back in.
Okay, so besides just spotting problems, you can also guide patients to the right products. When a patient is just staring at that wall of different contact lens solutions, you can be the one to give them the clear, simple guidance they really need.
Really, it all boils down to two main types: multipurpose solutions and hydrogen peroxide systems. Multipurpose is the easy, all-in-one option that's great for most people. Hydrogen peroxide systems, on the other hand, are amazing for patients who have sensitivities to preservatives. But, and this is a huge but, they require a mandatory 6-hour neutralization period. You have to warn them. If they put that lens in their eye too early, they are going to get a very painful chemical burn.
And no matter which system they choose, the daily routine has 5 absolutely non-negotiable steps. It always starts with clean hands. But the one step I really want you to emphasize is step 2, physically rubbing the lens. This simple motion is so important for removing debris, and it's the one thing almost everyone skips.
All right, let's boil this all down. Let's do a few rapid-fire, really memorable takeaways. These are the things you can and absolutely should tell every single patient who wears contact lenses.
First, and most importantly, no water, period. Not tap water, not bottled water, and definitely not saliva. Water has microorganisms that can cause devastating infections. This is an absolute rule, 0 exceptions.
Second, tell them to never ever just top up the old solution in their lens case. We've seen that over half of all cases are contaminated. Topping up is basically like adding a little clean water to a dirty bathtub. It just makes a mess. You gotta dump the old stuff and use fresh solution every single time.
And right on the heels of that, the case itself is a major problem. It's like a little petri dish for microbes. It's not enough to just use fresh solution. The case has to be replaced regularly. It's a key part of the whole hygiene system.
So how often is regularly? At the very least, every 3 months. An easy way to frame it for them is to just say, get a new case every time you buy a big new bottle of solution. It's a simple little habit that can dramatically cut their risk of infection.
And this brings us to the final and maybe the most important point of all. If we want to fix that staggering 99% non-adherence rate, it's not enough to just give people a list of rules. We have to explain the why. When you explain that rubbing the lens removes the food that bacteria eat, or that tap water can literally cause blindness, that's what turns a rule into a reason. And that's how you chip away at that 99% statistic, one conversation at a time. That's the real power you have at the counter.